Welcome to News West 9's West Texas View with Johnny Lou Avery.
Welcome to our program today. It's such a treat to have back with us in the studio Dr. Bobby Jain, who is a psychiatrist, and he teaches at the Texas Tech University Health Science Center, but he also has practice through the Texas Tech Clinic and practices in both Odessa and Midland Clinic. And every time he's here, we always just have a slew of questions that come to me afterwards and say the next time he can stop by, be sure and ask him these questions. So I'm going to be interjecting a lot of questions into our conversation this morning. But Bobby, thank you so much for coming back by and seeing us again today. It's always such a treat to have you.
Well, the pleasure is all mine, talking to your audience and being able to talk to you, seeing your personality and your smiling faces always feels so welcome. And also, we always talk about, we live in ivory towers in medical schools and institutions. It's very good to connect one-to-one with your audience, and with your program, I can reach millions of folks.
That's right.
And talk about issues. My field being mental illness, I can reach with a lot of folks through your medium. So thank you again for inviting me.
Well, before we go on, for the new people in the audience that haven't seen the program before, and seen you on the program before, talk a little bit about how you are both a practicing physician and a teacher in the medical school, and how important this is for people to understand this concept.
And that's one of the reasons I got attracted to this line of vocation to see. I was originally hired by the Texas Tech Permian Basin to develop a program for teaching and training young folks, medical students, in the field of psychiatry. That's one of my major job is. So we train future doctors, and also another part is to treat patients clinically for various psychiatric reasons.
So that keeps you up to date as well as keeps your hand in and helping.
And that's one of the reasons, because unless you know yourself what you're going to teach, so it forces you to be current and up to date and the cutting edge of what's going on in the field of mental health, and also helps me to try my best to see if I can train and encourage folks, young generation, to come in this my field, because there is always a shortage of psychiatrists throughout the country, be an adult psychiatrist or any other field of psychiatry. There's always an underserved area.
Yes, and because mental health is something that until just recently didn't get a lot of attention, and it's just as important as physical health. And so it's really, really important that we look at the whole thing.
Right. So what I would say that, yes, mental health has always gotten the most drawback in terms of attracting funding, in terms of getting the best of the brains in the field of medicine to come and talk to and be interested in this field. However, we were realizing that there's not a single chronic illness that does not have a mental health component, be it diabetes, be it chronic heart condition, be it
pregnancy. We're going to talk about,
even though pregnancy is not an illness, but being pregnant is not an illness. But you're right. But
it's a physical condition.
It's a physical condition, and and women go through a whole lot. And I think we should talk about this. That when women go through pregnancy and when post-pregnancy of childbirth, the sudden changes that happens in the body predisposes them to a number of mental illness conditions, be it depression or things or not. So you can treat a body, but the body is attached to a head, and the head is attached to, has got a mind. So emotional illnesses are an empirical part of any form of illness that you see.
And that's why every medical student in any medical school, whether it's Texas Tech or somewhere else, all the students rotate through all the disciplines. So an OBGYN or an internal surgeon would come through during their
We call some of the core core specialties. They're required to do that. There are 6 core specialties that the medical students are required to do that no matter what. Among them, of course, surgery, OBGYN, family practice, internal medicine, pediatrics, And the sixth one is psychiatry. And I'm glad they're recognizing that this is a core specialty that all medical students should have basic understanding of psychiatric illnesses. And the time of exposure, they may vary. Some institutions have 6 weeks. We provide them 8 weeks of psychiatric training, which is the maximum we can provide. And we do provide them exposure to various forms of psychiatric illnesses that we go through in Western world.
Well, when you talk about the students that are rotating through there, do you have, for example, a group that come all from OBGYN and they go out, or do you have mixed students?
Well, what happens is that they go through 8 weeks block. So in 8 weeks, they're required to do, when they're doing psychiatry, they're just doing psychiatry for 8 weeks. Now, within psychiatry, they may have different exposure. For example, they may have 1 week with me as an outpatient setting. 1 week they go to Big Spring State Hospital, which is an inpatient psychiatric facility. Then we have a couple of community psychiatrists who are volunteering the time to have our medical students there. So we try to give them as much varied exposure within the field we have. Once they are done with 8 weeks, they move on to the next one, be it surgery, internal medicine, pediatrics, OBGYN, whatever it is. So they go through rotations of 8 weeks each, kind of blocks of times.
Well, when a doctor gets, I know they have to have so much in-service education or continuing education.
Right.
And so do they choose then which of the 8 disciplines they want to go into?
They can, yes, they can go to anyone, but there are other specialties also. For example, in internal medicine, they may go to geriatrics, they may go to neurology, which is an offshoot of medicine, for example. So, or they may go to cardiology. Surgery, they may go to
or
different
even pharmacology or something.
Pharmacology would be, they can train to go to basic science field, but they don't have to do residency for that. Any clinical sciences, they have to go further training. So basic trainings are there, and then they can go specializing. For example, if you want to be a cardiologist, you have to do 3 years of basic internal medicine training, and then 4 years, up to 4 years of cardiology specialization. So these are core subjects, and they can specialize further. In my field, for example, you can be an adult psychiatrist, which is a core training, and then you can specialize. Like I did specialization in child psychiatry.
And that's what's garnered a lot of comments when we've had it. We're going to have to take a break right now. We'll be back in just a minute and continue this conversation.
Stay tuned. West Texas View will be right back.